My name is Laura Schwab-Reese. I'm an assistant professor of public health at Purdue University. I was first trained in mental health counseling. I have a master's in mental health counseling, and then I decided that I really thought that the community aspects of health were important. So I went back to school and I got a PhD in community and behavioral health, which focuses on public health community level interventions.
Hi, my name is Macy Simmons. I'm the Director of Recovery Support Services with InWell. I'm a person in long-term recovery from substance use disorder and mental health as well. Growing up, I've had exposure to stimulants. I've used stimulants. I've found recovery from them, and now I'm kind of on the other end of the spectrum where I'm working with people striving to recover from stimulant use disorder.
I don't think many people start using with the goal of, I want to be addicted to this substance. I want to be chained to this addiction. We see in many rural areas that stimulant use and opioid use are increasing. And I think that there are several factors that contribute to that. But I think the primary one, in my perspective, is access.
It's a shock factor when people realize how easy it is and how common it is that people are using Coke or meth or Adderall or things like that, but it's cheap to make and it's highly addictive.
In the past, we have treated it as we have a marijuana problem, or we have a methamphetamine problem, or we have a cocaine problem. And I think what we're starting to learn is that a substance abuse problem is a substance abuse problem.
Just because it wasn't your drug of choice when you started doesn't mean it can't be your drug of choice down the road. I never ever thought that I would be addicted to speed because I was an anxious, nervous person, and that sounded horrible to me. And I found myself addicted to Adderall, and then when I couldn't find Adderall and I was working full-time and trying to keep up with life, and addicted to that, I was easily able to find meth, and it was cheaper. I was easily able to find cocaine wherever I needed to find it and when I needed to find it, which is insane, I know, looking back. Now, currently, with stimulants, I would say it's methamphetamine. It's just readily available anywhere that you would want to find it. It's not very difficult. There's usually somebody that knows somebody that's doing it. Working in a rural community where there's lots of factories and you've got 200 or 300 people in the same space, run down and tired, working 12-hour shifts. Everybody knows everybody. Mandatory overtime for 7 days a week. It's a breeding ground for somebody to get addicted to a stimulant.
Where you live makes such an important impact on your health. Who is in your social network makes such an important impact on your health. People who are living in poverty, people who don't have access to food on a consistent basis, people who maybe don't feel like anyone cares about them.
So growing up in a rural community, we typically hung out and all met up at an old rundown parking lot because that was our gathering place. We didn't really have a safe space to hang out and be kids. And so that ultimately led into using substances and then obviously not having any supervision over any of that as well. The challenges that we face in rural communities when we're addicted to substances are knowing everybody. So we might only have 2 gas stations, and one of the 2 is a hot spot for where I pick up my stuff. So everything's really tied close together. Everybody knows everybody, and that can either be really good, and it does become good in my recovery journey, but at the time when you're tied up in all of it, it's a really, really hard barrier to be up against, knowing everybody and seeing people that you know that are high.
One thing that is maybe becoming more recognized is the role of adverse childhood experiences and trauma. Trauma can lead to feeling pretty terrible in your day-to-day life, and so you're just looking sometimes with substance use to get back to a neutral, to get back to a place where you don't feel bad.
I know for me that I had a very traumatic childhood, and I know that directly played into my substance use. When I have something in my brain that triggers me to be on high alert and stressed all the time, and I find something to turn that off and numb it out, then I'm going to be very susceptible to using that substance and becoming addicted to it. I use a substance and I'm on top of the world and I'm able to talk to you and I feel like Superwoman, and now I can go get that job and I can ask for that raise, or I can do this or I can do that. I'm going to want to keep doing it. A lot of those factors come into play with addiction. And then before you know it, all of those, what you think were positive things, ultimately disappear very quickly.
We know now that there is a strong genetic component to substance use disorder, which is actually what happened to my brother-in-law. He tended to use alcohol quite a lot, but he lost his job in his early 20s, and that was obviously a very stressful experience for him, and that kind of set him on the path of using to a different level. So he probably did have the predisposition, but it wasn't until that very stressful experience of losing his job that he really moved into using in a way that was detrimental to his health.
If I decide that I want help in a rural community and I make the phone call to schedule a time to talk to somebody about getting help, it could potentially be several weeks to a month before I get to sit down with somebody, and that's a very dangerous, deadly time to ask somebody that's using substances like meth, stimulants, and things like that to wait. They may not even have the ability to see you as often as you need. So unfortunately, a fix for substance use isn't just seeing a therapist once a month. More than likely, you're going to need intensive groups, just really a lot of one-on-one intensive things that unfortunately you're just not going to get in a smaller community.
We know that healthcare access is poorer in rural communities, so you kind of layer on maybe a little bit more hesitance towards getting access to care. We now have a group of people that they don't have access to broadband internet or internet that's fast enough to use telehealth, so they're being left behind in that way also.
Once I was able to get to the city, out of my rural community, I was able to get plugged in inpatient treatment, supportive housing when I got out. There were just a wealth of resources available for me up there versus where I was from.
It's important for people to have access to mental health care. I will continue to say that over and over. As someone who is trained in mental health and therapy, I will 100% say we need people to have access to mental health care. But we also need people to live in healthy communities and to have access to the things that they need to be healthy in other ways.
I think one of the biggest challenges anywhere across the board for finding recovery from substance use and stimulant use is stigma.
There are so many things that contribute to stigmas, both in rural areas and urban areas. We see kind of an us versus them mentality. People who are using are, those people. They're not our friends, they're not our neighbors, they're not our family, they're kind of those folks.
You're less likely to receive adequate care because somebody might have stigma towards you or holding that stereotype or bias. A lot of times people aren't going to shift their beliefs with something like that unless it's their son or their daughter, their mother, their father.
In many areas, there's still the idea that it's someone's choice, that people are choosing to be addicted, that they get up in the morning and they want to use. And I think that discounts how much we know in the research now about so many factors contribute to substance use disorder.
In the beginning, when I was a kid and I was in school addicted to stimulants, my guidance counselor and my principal, the other kids that I went to school with, ultimately kind of started to shun me, or maybe was like, I was getting the vibe that I was a lost cause. Looking back and seeing all these missed interventions, it makes me wonder, why didn't anybody step in? When I was obviously screaming pretty loud cries of help.
There's also a real sense that it's something to be ashamed of. It's actually very interesting. My brother-in-law died of an overdose, and as I was preparing to talk about this today, I went to my husband and I said, "Are you okay with me talking about it?" Which I think just further reflects how much shame there is, or how much shame there has the potential to be, because I was afraid that by talking about my brother-in-law, I would hurt my husband, which I obviously didn't want to do. And I was so grateful that he said, I think it's very important that people know that it's everywhere.
Just because somebody is addicted to substances doesn't necessarily mean that they don't have a job, they don't have a home, they don't have a car. Sometimes it just takes a person's story to soften someone else's heart. And behind all of what I just said ultimately means that they're human and they're people and they deserve love and support, even if they were using substances.
We often think that criminal justice is the solution to substance use, that we just need more police or we just need police to be doing different things. And I think that that ignores the importance of primary prevention.
A lot of times when there's a lack of education or awareness, we see more of like a punishment to try to deter people from using those substances, even with kids. I look back and I see many opportunities, many missed opportunities for me as a kid. How is this kid getting access to these things, and why is she struggling so much, and what can we do to help her?
Let's not have kids who want to use substances. Let's have kids who are in happy, healthy families and are in productive schools where they feel people care for them and they feel like someone in their community cares for them. Invested adults can make such a substantial impact in the lives of young people. The more that adults in the community can buy into that, the more that we return to a little bit of a sense of neighborhood.
We've seen a really great shift in perspective in addressing substance use in rural communities today. I'm really encouraged looking forward in the next 5 years at the way that we approach substance use, the stigma surrounding it, how we accept harm reduction and meet people where they're at. You know, it's baby steps, but we're getting there.
It can be easy to go and say, I have the answer for you, you just need to do this. And so understanding more about the complexity, understanding more about how complicated people's lives can be sometimes is a really excellent place to start.
I continue to circle back to education and awareness. We just have to continue to have these conversations in order to shift people's beliefs, and it may be one person at a time that we do it, but if that's what it takes.
I think for folks who are more familiar with maybe someone in their life has experienced substance use disorder, one thing they can do is self-care. When my brother-in-law was using, it was very easy to be angry with him, to feel like, why don't you just get it together? Like, stop using. And it's easy to be angry. There's a need to be empathetic and compassionate for the person who is using and also for yourself. I feel so incredibly guilty, or I felt very guilty after my brother-in-law died, that there was something I should have done. And maybe there is something that I could have done. But forgiving myself for that, kind of letting go of that guilt, was a really important part of me being able to come back to this work.
If you know somebody that is using substances or have a loved one that's using substances, they're not in the driver's seat anymore. So that person is no longer in control of their actions. They're not thinking logically, and you may want to be mad at the person, but they're very, very sick. Setting healthy boundaries is going to help both of you, but ultimately they need to know that they're loved and supported, and then they might decide to talk to you about the fact that they need help, and then they might never. But at least they were loved and supported, and not enabled, but just knowing that they're very sick.
And so if there are things in your community that you can do to help others feel happier or healthier, whether it's volunteering with something like Big Brother, Big Sister, or if your community has issues with food insecurity, working with others in the community to try to address that need.
For somebody that is living in a rural community, out there ready to help and not sure where to go, plug into your local coordinating council. If you don't know what that is, you can Google it. Every county in the state of Indiana should have that. And those are going to be coalition members and people just like you who want to gather and talk about these issues, and then also figure out how you can contribute to learning and spreading that awareness. There's some really cool state programs like the Indiana Recovery Network. You can plug in with them and they can let you know what's going on in your community and how you can help. There's harmreduction.org as well. They'll plug you into what you have in your community, and then if you don't have anything, then they'll certainly give you some things to do if you'd like to do those. Sometimes you might be the only good thing in somebody's day, and I know that that rings true for somebody that's struggling with substances and may not be carrying themselves as highly as other people. So just showing a little bit of love and grace for those that are struggling with that goes a long way.